Thank you, listeners, for joining us today. I'm your host, Lori Gilbert, for KELK and our show, Elko Live. And we're very pleased to have our guest in studio today to talk about an important aspect of healthcare in our community, and that is the services provided by Nevada Health Center. They've had some exciting advances and a wonderful announcement of an open house that we all get to celebrate with them. Stephanie White is the Senior Practice Manager of the medical side. And welcome back to the program, Stephanie. It's always nice to see you. Thank you.
Thanks for inviting us. It's good to see you too, Lori.
Absolutely. And Erin Bernius is here, and Erin is the Marketing Outreach Specialist, and she's helped put together today's program, Erin, and we sure appreciate your expertise in being on the program as well.
Oh, thank you. Absolutely. Thank you for having us.
Absolutely. So among the issues we want to talk about today, because there is this illness going around again, and it got a lot of attention a couple of years ago, but COVID is still out there, and so it's important that we remind people that they can be immunized for this, right, Stephanie?
That is correct. It is definitely cold and flu season, along with COVID again, so I encourage everybody to get that out there and get your immunizations. Currently at Nevada Health Centers, we're doing flu shots, but we currently do not have the new COVID, but there are others in town and a lot of the pharmacies.
All right, so it's important to make your appointment. Obviously, you can do that through Nevada Health Centers, right, Stephanie? At least for the flu and the RSV, probably.
Correct.
Mm-hmm.
Yes.
And then you can contact your local pharmacy for the COVID immunization. There are new immunizations, or you can get a booster, I think, of the existing. Probably started over by now, I think, with the new round of COVID shots, right?
Yes, there is new COVID out there. Again, at the pharmacies in town, and the new flu shot, which usually starts the beginning to middle of September.
Okay, so if you don't have that one under your belt yet, it's time to get immunized so you can stay healthy all this happy holiday season, because there's a lot of cool stuff going on, including an open house that's coming up next week. And either Stephanie or Erin, who wanted to talk about that today?
I could talk about it.
That'd be awesome.
Yeah, so our open house is Wednesday, November 1st. Anyone can stop by between 5 and 7. Ogie Deli will be catering. We'll have light refreshments, little snack foods, and then some, teas, lemonades, water. And then we're also doing giveaway prizes. So anyone who comes in can, put their name on a ticket, raffle off, and maybe win a giveaway prize. So
super cool. And there are a great variety of prizes that you're going to give away to celebrate, right?
Yeah, so we have some self-care baskets. It's kind of a self-care theme, self-care baskets, coffee baskets. What else? We have a whole variety of snack baskets, Amazon gift cards. And really what the open house is for is to remind the community of our healthcare services and to remind everybody that we are there to serve. And that's why we wanted to have this open house.
And it's going to be a real treat, Erin, because we know that this is a building. It was the former Elko clinic, so there's a lot of local history there for providing medical needs throughout the community. But you were able to renovate this facility completely, and you did it with a lot of community support. That's pretty significant.
Yes, so it was renovated before my time with Nevada Health Centers, but I remember going to the old Elko clinic as a child, and I feel like if you walked in, you wouldn't even recognize it. It's so beautiful. It's so modern. It smells new.
Yep, it's nice. And Stephanie is the Senior Practice Manager. I'm sure you could agree. I think you were there for some of the the renovation that was going on.
Yes, they actually did it in 4 different parts, and it's been 4 years coming. And so we finally are done at this point. And anyone in the community is welcome to come and take a tour on that day, on November 1st from 5 to 7.
Oh, nice. Stephanie, did you want to talk about, because again, 4 different phases to accommodate growing and expanding service. Nevada Health Center is unique in that before Nevada Health Center, it was really hard to get comprehensive health care in one location, and it was excruciating to make appointments if you didn't have insurance, for example. I mean, this facility is meeting all kinds of community needs.
Yeah, so we definitely accept most insurances, including Medicare and Medicaid. We have a sliding fee discount as well, depending on family and income. And we do not turn anybody away. We're here to serve the community. And we have a variety of primary health services, including family medicine, dental. We have a new pharmacy that has just been added. We have telehealth visits that we can do and behavioral health. And as always, we continue to do women's health. We have our mammogram that comes twice a year to the Elko location as well.
Very nice, and I think you have quite a great reputation for, especially any number of these services, but the women's health care, I've heard great things about that too, so it's nice to know that you have those choices in the community. Did you want to talk maybe, Erin, about the expansion of the pharmacy and how people can access that facility, right? That was grown out of a need.
Yes, so we do have a new pharmacy. You must be a patient of record to be able to use the pharmacy facility, but that's where we're at, and that's also beautiful. That will also be part of the tour as well. It's quite amazing, actually.
Oh, nice. State-of-the-art pharmacy. And it's important from what Erin just described, Stephanie, the reason that, you're a patient of record is that's really for the ease and convenience. It helps with, I'm sure, the network communication. You don't have to go anywhere. You don't have to leave the campus to get your pharmacy.
Correct. It's kind of a one-stop shop now. And it's been great for our patients, especially those on low income and our slide patients, to be able to get their medications at a reasonable cost.
So if that is something, obviously, if you're looking for a primary care provider, maybe you're a parent, maybe you're a senior citizen, there are people that are experiencing all kinds of different health issues right now. Stephanie, what's the best way to access Nevada Health Center?
The best way would be to call our main number, which is 775-738-5850, and we do answer our own local calls, so you can call and get one of our front desk staff and schedule an appointment. So we do have 3 providers on staff for medical. We have Dr. Stephen Lohr, and we have 2 physician assistants, Spencer Davis and Calissa Bittner. We have a new provider that will be starting with us in January that's local here in town, we'll just say. And he'll be joining us in January, and we are still recruiting for additional.
Well, that's exciting. It's nice to bring in new providers at the same time. Often they come with families or they're just getting started, but it's also nice to continue services that people are familiar with from within the community. That's nice.
Correct. And yes, we are accepting new patients.
Oh, and that's also important to know. So again, family medicine, dental health, the new pharmacy right there on the campus. We should mention Nevada Health Center is located right there just off of Cedar Street, right? The actual address?
It is at 762 14th Street.
762 14th Street.
Correct.
All right. So that is, that was not me.
I was like, yeah.
You're fine, Erin. I was sure it was
I heard
me.
it. I was like, what is that?
I'm sure it was me. So 762 14th Street, right there. It's a real family-friendly location within walking distance of the swimming pool, of local neighborhoods. So again, it just makes it really friendly to be able to get there. You can get my ride if you need to get public transportation.
Yes, we have a lot of patients that use Get My Ride and Access to Healthcare van that we now have in town.
I'm so glad you mentioned that, Stephanie, because a lot of times people haven't been to the doctor because they have not successfully navigated their healthcare options. And it sounds like access to healthcare is an important partner.
Yes, and Get My Ride.
Yes.
They do a great job here in Elko.
So don't hesitate. Call that number again, which we're going to give that number because I'm going to write it down this time. I was slow with my pencil. It is
775-738-5850.
Okay. And that's for anyone who needs an appointment. If you have children who need dental, if you're in a distant location and you're listening to KELK, first of all, we appreciate you very much. And we want to know that this outreach continues through telehealth, right? If you have a mobile device, you might be able to access some health care.
That's correct.
So that's really important to note as well. So let's talk about, with you, Erin, and then we'll switch back over to you, Stephanie, about the dental practice in particular, because of, of a lot of the services provided, people can be hesitant to go to the dentist. And if you neglect your dental care, that can really be a contributing factor to a lot of other health issues.
Yes, and our providers are great. Dr. Putnam, he's amazing. And dental accepts Medicaid for children as well. And then we do accept Medicaid for adults. That's just a little different for adults. They'll accept emergency exams, but it's just coming in.
Yeah, Dr. Putnam is great.
Okay.
He served as our county health officer, too. I believe he may still have that position. So he really understands what the needs are in the community, throughout the county, in this vast region, how important Nevada health centers are to providing these services. Again, Nevada Health Centers is the location that will accept most insurances, including Medicare and Medicaid, and they don't turn people away. So they do offer a sliding fee discount, and it is based on your family size and income. So it's really important. We love having you guys on to talk about this because, this is a time of year where people get sick and kids run fevers. And if you're new to the community, maybe you don't have a primary care provider, right, Stephanie?
Correct. And like I was saying before, we do accept new patients. I also want to point out, you were talking about all those people out there in the rural areas. In Elko County, we also have a facility in Carlin and Jackpot and Wendover. So we might be closer to you in one of those locations than Elko, but we all are accepting new patients.
Well, thank you for reminding me of that.
And dental is also accepting new patients as well. I just want to clarify. And sometimes people might know us as the Elko Family Medical and Dental Center, but it's the same as Nevada Health Centers.
Oh,
Yes.
I see. Okay. That is important to
Yes.
know. Okay. Elko Family, but the same as Nevada Health Centers.
Yep.
So for both family medicine and for dental health and for pediatrics, for example, Erin, if a little one needs to go to the dentist, Stephanie, yeah?
Yeah, for dental and medical. And I just want to remind everybody also that we do immunizations. And if they're school age immunizations, they don't have to see a provider. They can come in and get their updated shots. And we do those on Wednesday afternoons every week from 1 to 4.
Wednesday, 1 to 4. So if mom and dad pick you up from school and take you to Nevada Health Centers, maybe there'll be a little treat afterwards, right?
Right, exactly.
So always something to look forward to. So get those immunizations up to date as well. And then family medicine, I don't know, Stephanie, if there's anything in particular that, people have special needs in the community. We're going to talk about behavioral health because that is a huge component of what our community needs right now. But just as far as, are we just seeing seasonal illnesses perhaps? Or
We would definitely see those. We see a lot of more complicated cases as well. Diabetes is big in this community, and it's big with dental as well. I've just recently learned from dental how it can affect your teeth. So we do treat a lot of those patients.
So for good nutritional advice, get a foundation in, having a better diet. That should help you avoid those.
Correct. We actually have an RN on staff that does, diabetes education for nutrition. So that is available at our center as well. So she'll spend an hour with you just going over what to eat, what not to eat, and how to make your diet healthier.
Wow, that's a great service offered, and that's something that you can make an appointment for?
Correct.
Okay. So again, we're talking with our representatives from Nevada Health Centers right here in Elko, or of course, Jackpot, Carlin, and Wendover locations serving rural Nevada. They have 26 facilities throughout the state. So that's a lot of dedication, Stephanie.
Correct. We have a lot of facilities in Vegas as well as Carson City.
So if you are interested, again, you can make an appointment. And I know Erin's going to tell us more. We're going to emphasize this special occasion, which is an open house. Yes, it's coming right up, too. We appreciate that. And again, thank you to Dr. Bryce Putnam for extending his services, not only as just providing dental care to the community, but as our county health officer. But it looks like he has other folks on staff, including Brooke and Myra.
Yes, Brooke Smith and Myra Gonzalez. They are also there. They are in our dental department, and they're great too. I went to an event with them, and all the kids seem to know them. So that was, I think when children go in to get their teeth cleaned, because that's kind of a scary feeling, they feel comforted knowing that we have great staff.
It really makes a huge difference, and it puts parents at peace of mind, too, knowing that they don't have to struggle, to get kids into the dentist.
Yes, and I want to just emphasize again that for dental, we accept Medicaid. Mm-hmm. And so I'm not sure if we're one of the only health centers in the area that accept Medicaid, but we do accept that. So I think I really want to emphasize to the community that if you have that insurance, please come in.
All right.
Especially for children.
Especially for children. And as soon as their teeth start coming, I understand that you can, you can take toddlers to the dentist. It's important to get started early, right?
Yes.
So make it a friendly, fun occasion. They can see Dr. Bryce Putnam, Brooke Smith, Myra Gonzalez there at the dental clinic at Elko Family Dental, Nevada Health Center at 762 14th Street. 775-738-5850 is the number to call. So we talked about, obviously, the family medicine, the dental health, the brand new pharmacy, which is right there on site, which you get to see when you come to the open house on Wednesday, November 1st, 5 to 7 p.m. Now let's talk about the telehealth and behavioral health, if you wouldn't mind, ladies. And is that a new addition, Stephanie? Or
No, we've had our telehealth services for a long time. We've been utilizing them more lately. Now that we have a little bit of a shortage of providers, if you come in, walk in same day, you might see a telehealth provider. So what that means is we would have a medical assistant that would help you through the visit. They take you into a room and present you in front of a telehealth cart, which is state-of-the-art technology where the provider can even listen to your lungs, your heart, look at your skin if they need to. They have the capability of doing all sorts of things, but they're on the other end in another location. So we have providers throughout our organization that take turns doing those telehealth visits, and we have those available every day.
Now, Stephanie White is a senior practice manager in the medical side for Nevada Health Centers, and so she's very familiar with this technology. A lot of people are becoming much more comfortable with this kind of telehealth. In fact, you can really get great one-on-one care, I understand.
Yes, definitely. And we also do what we would call a V-Care virtual care appointment, which would be one you would do through your phone if you are a patient of record. But the telehealth is a little different, where you actually, if you don't have that technology to do it at home, you can come into our facility and we help you through that visit.
I think you mentioned something important too, in that you get sort of a physical overview, the initial assessment, just to make sure there aren't any underlying health issues to your mental state, right?
Correct. Yeah, it's always helpful to come in person where we can do your blood pressure, and if we need to do lab work, we have LabCorp on site that draws blood. So all of that is available if you come physically to the clinic versus trying to do something virtually. But if you don't have the capability to get in, we are willing to help you any way that we can to be seen.
Wow, Stephanie, you just said something else that's really super cool. LabCorp is on site?
Correct. We have a phlebotomist there, so they can draw blood, and he is there Monday through Thursday. So not on Fridays, but we still draw our own on Friday. But he is there Monday through Thursday, and people can walk in and get their blood drawn.
That's fantastic, because otherwise, for some facilities, you have to make a separate appointment, a separate day, you have to fast. And not that you wouldn't fast probably doing this too, but there are a lot of barriers for some people who, for them, healthcare it's a priority, but they don't know how to access it, or they don't have the resources or the means.
Correct. And like you were just saying, fasting is a big part of it. So if people come at 4:00 in the afternoon to see your provider, they can come back the next day or the day after and get their blood drawn at a different time.
Yeah.
And be fasting.
But that's so important to know, that you do have those labs available right there on the premises through Nevada Health Center. So it truly is. We can see that from where you started some 4 years ago, the community enthusiasm is there. You've been able to grow to provide these services, Stephanie, and look how much you've grown in the last 4 years.
Yes, definitely. Our facility is huge. It is worth coming down to see. And we currently have obviously all of our different departments, but we have 38 exam rooms, just to give you an example of how big our facility is.
Really? Just on that one existing footprint? Yeah. I think you were able to expand a little bit more toward I guess that would be the east or something, but 38 exam rooms.
Correct. On the medical side. That doesn't include the dental or behavioral health that we have, and pharmacy. It's a big building.
Yep, big building with a lot of caring people. And again, these targeted services for, the benefits of healthcare and mental wellness. So and other aspects of behavioral health, did we cover most of that, Stephanie, or or Erin, did you want to make sure that people know they can have access to some sort of therapy or counseling?
Yeah, so we do have a behavioral health program right now. If people were to call in, you would be talking to someone based in Carson or Las Vegas. We are actively recruiting for an in-person provider to be here for a behavioral health program. But that's also one other service we offer that is great for the community, and that's also why we call ourselves the one-stop shop. It's all integrated, medical and behavioral health.
Oh, and just about anyone at any time would benefit from speaking to a behavioral health specialist, correct? I mean, it's a stigma that we're all working together as a community to overcome.
Oh, for sure. I think anybody and anyone could benefit from talking with a behavioral health specialist. You know, it's nice to be able to talk to someone that's not always maybe your family member or friend. And plus, it's all integrated. So when patients come in, they might see a medical provider first, like Dr. Lore, for example, and then maybe he'll do a warm handoff to our behavioral health provider. Mm-hmm. Sometimes that's how it works with the integrated approach.
Definitely. And I was just going to add to that. So it's kind of the same as like a telehealth visit. We have the technology there to put them in front of a screen with a provider. Mm-hmm. That Erin was talking about. A lot of times right now they're seeing Las Vegas or Carson, but we can put them right in front of them in our actual building. But we also do V-Care or virtual visits. If they have the technology on their phone, they can do those from home as well if they feel more comfortable.
Yes.
Wow, that is an incredible outreach, and again, taking advantage of the latest and best technology. Our guest today with Nevada Health Centers and talking about the open house, which the whole community is invited to on Wednesday, November 1st from 5 to 7 p.m. You can tour the newly renovated facility, meet the providers, and learn more about the services. You can enjoy free refreshments from Ogie Deli and sign up to win some prizes, all kinds of self-care from coffee baskets to Amazon gift cards. That sounds like a real treat. I would think, Stephanie, for both you and Erin, that having done this for the last several years, it has to be pretty rewarding. There have to be some success stories, some things that that Nevada Health Centers have made a difference in the lives of people.
Oh, yes, definitely. I think that happens every day at our facility.
Oh.
You know, it's hard, especially in the rural communities, to have access to health care. So I feel like every day there's at least one person that has had trouble that we are helping. And whether it be helping them get their ride or helping them get signed up for insurance through Medicaid, mm-hmm. or just getting them access to the provider that they need.
And Erin, this Nevada Health Centers is mission driven. I mean, isn't that right? We're familiar with a lot of, for-profit organizations, and there's nothing wrong with that. I mean, you can get expert care and fine tune the specialists that you're able to see, depending on what kind of insurance you have. But Nevada Health Centers is just reaching this broad spectrum of people.
Yes, and when I go to outreach events, people will come up to me and be like, "Oh, I know Nevada Health Centers," and they seem very thankful that it's here in Elko, where they may not have to travel to Salt Lake City, Twin, or Reno to get primary care services, and that feels good knowing that we can provide these services to the community and that we never turn people away.
Again, Nevada Healthcare, Nevada Health Centers, they do not turn people away, as Erin was just describing. They do accept most insurances, including Medicare and Medicaid, and they do have a sliding fee discount that's based on family size and income. So those are all really positive aspects of our local Nevada Health Centers right here in Elko at 762 14th Street. There's another topic on here for women's health, and I want to make sure we get to that. Stephanie, that's also got to be an exciting part of the practice.
Yes, we do a lot of women's health. We do birth control, we do pap smears. We, like I was saying before, have the mammo van that comes down on site, and that's very helpful for some of our slide or Medicaid patients to get that done as well.
And that mammo van, most people by now may be familiar, but in case you're not, that is now a digital screening for breast cancer, and it should be done routinely.
Correct. Once a year.
Yes, once a year, and it can make a huge difference, especially when you catch that early. There are lots of preventive measures, obviously things that can really turn those situations around, but you have to you have to get the early screening, right? So
Correct.
Yeah.
Yes.
Women as young as 40 can start getting their mammographies.
Yep.
So
And pap smears are also important as well for that early detection.
That's
And
true.
we have those available. And then back to, we also offer different forms of birth control and STD testing.
That's important, and I was going to mention that as well. So, especially in rural communities where, again, people may not have access to their to a regular, provider, a doctor, family medicine, someone that their family is seeing. So, if you are sexually active, it's important that you maintain your good health, and so you can come to Nevada Health Centers, and same as for family medicine or dental health, you call to make an appointment, Stephanie?
Correct. You would need to make an appointment for one of those services.
Okay. And any restrictions on that, or is that open to anyone?
It's open to anyone.
Okay. So important to know. And obviously, if you're a teenager and you're sexually active, hopefully you have a great relationship with your family and you can speak openly about anything you have concerns. But if you don't, there are professionals at Nevada Health Centers.
Correct. And we do confidential visits.
Okay, so important to know. Confidential visits, whether or not you need to speak to a physician, privately, or you simply have questions. But as you talked about access to birth control, that's available at Nevada Health Centers.
Yes.
Okay, and screening for STDs. Don't put that off because unfortunately, we have a prevalence of STDs in rural communities. That's just a fact, isn't it?
I believe so.
Yep.
yeah.
That is a fact of life. So it's time to start talking about that too and make sure that you have access through Nevada Health Centers. So the open house is coming up. It's on November 1st. You can come and tour this beautiful renovated facility that has a great local history for providing medical care at 762 14th Street in Elko. I want to make sure, Erin, did we get to the talking points today? I know we covered a lot of ground.
I think so. And just to, I just want to again say it's open to the public, the open house that's happening November 1st from 5 to 7. It's open to anyone, so come check it out.
Come check it out. Meet some really nice people who have great care for the community, providing these medical services. Dr. Stephen Lohr, Spencer Davis, and Calissa Bittner. Those are your medical providers. And then on the dental side, Dr. Bryce Putnam, Brooke Smith, and Myra Gonzalez. And you'll meet the rest of the staff as well. You've got to mention our pharmacist, right?
Yes, we have Sandra Schroeder and Jose Reynoso.
Correct.
Okay.
Oh, great. I think we know Sandra. I wonder if she used to work as a pharmacist somewhere else.
I think she did.
Yes. They both worked in the community prior to coming to Nevada Health Centers.
That's wonderful.
And they're both great pharmacists.
It's, if you go to the pharmacy regularly, you develop a relationship and a friendship. So that's part of that, dispensing medicine is a personal thing. So it's nice to have Sandra and Jose both on staff at Nevada Health Centers. That's fantastic. So the expansion includes both new professionals as well as some trusted local favorites.
Yes.
Oh.
Well, and they worked really hard to get the pharmacy up and going because, of all the laws and stuff with medication. I know they worked really hard for that. So, and they've got a great department too. The pharmacy department's also great.
Oh, so excited. It's nice to have someone you can go and ask questions of. So please do come out and support Nevada Health Centers. Again, I'm going to repeat the number because I know there's somebody out there saying, yeah, I really need to make an appointment. So here's your number to make an appointment, 775-738-5850. And you can get a checkup, you can get your physical, you can get your labs done, you can see the dentist, you can stop at the pharmacy right there on the premises. You can even check in on your behavioral health, or that of yours or your family members. So it's all one stop there at Nevada Health Centers.
Mm-hmm.
Yes, we appreciate it, Lori. Thanks for having us on. I just also want to say, Erin had kind of spoke to it a little bit, but we try to go to those outreach events, and in Elko, we need the whole community to come together. Mm-hmm. So we work with those partners in the community to help give patients access.
Thank you so much. And again, for extending yourselves and your dedication. And we invite all the community partners, again, to participate, to, make those referrals with Nevada Health Center, because this is a facility that is open to everyone. Again, accepting most insurances, Medicare, Medicaid, sliding fee discount based on family size and income. And the community invested in the facility too. There are a lot of donations that came in, private public partnerships to make the facility possible at 762 14th Street. So come and celebrate with the community. Nevada Health Center's open house is Wednesday, November 1st, 5 to 7, right there on site. You'll win some prizes, enjoy some refreshments, and meet some really cool people. And I bet you'll feel a lot better once you come away from that, physically and mentally, right?
Yes, definitely.
Thank you, ladies, both so much.
Thank you so much for having us.
Absolutely. I always look forward to visiting with, of course, the senior practice manager from Nevada Health Centers. On the medical side, it's Stephanie White, and Erin Bernius is our marketing outreach specialist for Nevada Health Centers. Thank you, listeners, for joining us for Elko Live today. We appreciate you being there on the other side and hope you call and make your appointment, 775-738-5850.